Hi everyone! Have you ever wondered what happens to the food you eat? How does your body break it down and turn into energy? Well, today, we're going to take an exciting journey of discovery through digestive system. Let's explore how our body processes food step by step. Let's get started! Let's follow the journey of food inside our body. Let's go! The digestive system is a group of organs that work together to break down food, absorb nutrients, and eliminate waste. This process allows our body to get the energy and nutrients it needs to function properly. The main organs of the digestive systems are mouth, esophagus, stomach, liver, gallbladder, small intestine, large intestine, rectum, and anus. The mouth is the beginning of digestive tract. In fact, digestion starts here before you even take the first bite of a meal. The smell of food triggers your salivary glands, making your mouth water. When you actually taste the food, saliva increases. Once you start chewing, other processes come into play. More saliva is produced. It contains substances including enzymes that starts the process of breaking down food. Esophagus. The esophagus is a muscular tube that goes from the throat behind the windpipe and to the stomach. Food gets pushed through the esophagus and into the stomach by a series of muscle contractions called peristalsis. Stomach. The stomach is a sac-like organ with strong muscular walls. It serves as a mixer and grinder of food. It puts out acid and powerful enzymes that continue the process of breaking down the food and changing it to a consistency of liquid or paste. There are three accessory organs the digestive system have. The organs that make up the biliary system play an essential role in helping your stomach and small intestine digest food.
First is the liver. The liver has many jobs. Two of its main ones in the digestive system are to make bile, a compound that helps you digest fat, and to process nutrients absorbed by the small intestine so your body can use them. Second is the gallbladder. The gallbladder is a storage sac for excess bile. Bile made in the liver travels to the small intestine via the bile ducts. If the intestine doesn't need it, the bile travels to the gallbladder, where it awaits the signal from the intestine that food is present. Pancreas. Among other functions, the pancreas discharges enzymes into the small intestine that work to break down protein, fat, and carbohydrates from the food we eat. It also makes insulin, a hormone that helps you digest sugars.
Small intestine. Small intestine is the workhorse of digestion and is made up of three segments: the duodenum, jejunum, and ileum. This is where most nutrients are absorbed. Did you know that small intestine is a long tube loosely coiled in your abdomen, and if spread out, it would be more than 20 feet long? Large intestine. The colon or large intestine is a 5 to 7 feet long muscular tube linking your small intestine to your rectum. This very specialized organ processes waste so you can eliminate it as stool. Rectum. Rectum is the 8-inch long section at the bottom of your colon. When it fills with poop, its walls get stretched, signaling your brain that you need to go to the bathroom. If that's not convenient at the moment, the rectum stores the poop until you can go. Anus. The end point of your digestive tract is the anus, the opening where poop leaves your body. It's lined with muscles that help you control when you poop. A ring of muscle called the anal sphincter keeps the opening closed until you're ready to go.
Hey! I have a question. What's happening if we don't take care of our digestive system? Are there diseases that we can get?
Yes, if you don't take care of our digestive system, we can develop several digestive disorders.
Acid reflux. Acid reflux happens when stomach acid flows back up into the esophagus. This can cause a burning sensation in the chest, known as heartburn, as well as regurgitation, a sour taste in the mouth, and sometimes difficulty swallowing. However, when acid reflux happens repeatedly over time, it can cause GERD, gastroesophageal reflux disease, or GERD. It's a condition where stomach acid repeatedly flows back into the esophagus, causing irritation. Some lifestyle issues that can cause GERD may include being overweight, lying down or reclining after eating, overeating, eating foods such as citrus, peppermint, chocolate, and fatty or spicy foods, having caffeine, having alcohol, smoking, using aspirin and over-the-counter pain and fever medicine. Celiac disease. Celiac disease is a long-term chronic digestive disorder that damages the small intestine and prevents the body from absorbing nutrients properly. It occurs in people who have an immune reaction to gluten. When gluten is consumed, the immune system attacks the small intestine, leading to damage that affects nutrient absorption. This can cause digestive issues, fatigue, anemia, and other health problems. Celiac disease is primarily genetic, meaning it runs in families. However, certain factors like stress, infection, or surgery can trigger its onset.
Constipation. Constipation happens because your colon, large intestine, absorbs too much water from your poop. This dries out of your poop, making it hard in consistency and difficult to push out of your body. What causes constipation? Common lifestyle causes of constipation include not eating enough fiber, dehydration, not getting enough exercise, changes in your regular routine such as traveling or eating, or going to bed at different times, consuming large amount of milk or cheese, stress, resisting the urge to have a bowel movement. Diarrhea. Diarrhea means having a loose, watery stool or poop during a bowel movement. It is common in both children and adults and usually goes away on its own within a few days. If it doesn't improve, or if you're experiencing other symptoms like a fever or bloody stool, reach out to a provider to get the treatment and relief you need. The causes of diarrhea includes the following: infections, food poisoning, medications, food intolerance, diseases affecting your bowels, procedures on your bowels, germs, diseases affecting your gut, and even treatments can all cause diarrhea.
Diverticulosis. It is a condition where small pouches or diverticula form in the walls of the colon, usually without symptoms. When these pouches become inflamed or infected, causing pain, fever, and digestive issues. The causes of diverticulosis are low-fiber diet, chronic constipation or straining during bowel movements, aging, or more common in older adults, obesity, lack of physical activity, smoking, and certain medications, such as NSAIDs and steroids. Gastroenteritis, the inflammation of the stomach and intestines, leading to symptoms like diarrhea, vomiting, nausea, and abdominal cramps. It is commonly known as the stomach flu. The causes of gastroenteritis are viral infections such as norovirus and rotavirus, bacterial infections such as E. coli and salmonella, parasitic infections such as Giardia and Cryptosporidium, contaminated food or water, poor hygiene or close contact with an infected person, and also certain medications, such as antibiotics disrupting gut bacteria.
Hemorrhoids or piles. Hemorrhoids are swollen and large veins that form inside and outside of your anus and rectum. They can be painful and uncomfortable and cause rectal bleeding. Hemorrhoids are also called piles. We're all born with hemorrhoids, but at baseline, they don't bother us. It's only when they become swollen and enlarged that they produce irritating symptoms. You may be more at risk if you are overweight or obese, pregnant, eat a low-fiber diet, have chronic constipation or diarrhea, regularly lift heavy objects, spend a lot of time sitting on the toilet, and strain while having bowel movements. Inflammatory bowel disease refers to diseases that cause chronic inflammation in your gastrointestinal tract. Its symptoms may come on suddenly or it may flare up and cause intense stomach cramps and diarrhea, among other issues. But IBD can affect more than your gut. It can affect your overall physical health, emotional well-being, and even your mental health. The exact cause of inflammatory bowel disease is unknown, but it's believed to be a result of a complex interplay between genetic and environmental factors that trigger an immune response. Causes of inflammatory bowel diseases are immune system dysfunction, genetic factors, environmental triggers such as eating more ultra-processed foods, using oral contraceptives, taking non-steroidal anti-inflammatory drugs, being raised in a sterile environment with limited exposure to germs, having a gastrointestinal infection early in life, taking antibiotics during the first year of life, and being mostly bottle-fed.
Ulcers. Stomach ulcers, also called peptic ulcers, are open sores that form on the lining of the stomach or the upper part of the small intestine, also called the duodenum. They occur when the protective mucous layer of the stomach is weakened, allowing stomach acid to damage the tissue in the stomach. Common causes of stomach ulcers. Firstly is the Helicobacter pylori or H. pylori infection. This common bacterium lives in the stomach and can cause inflammation and ulcers. Secondly is the overuse of non-steroidal anti-inflammatory drugs or NSAIDs. NSAIDs like ibuprofen, naproxen, and aspirin can irritate the stomach lining and lead to ulcers. Common causes of stomach ulcers. Zollinger-Ellison syndrome. This rare condition causes the stomach to produce too much acid. Secondly is the severe psychological stress. Stress ulcers can develop quickly in response to severe illness, burns, or injuries.
Now that we know the diseases we can get if we don't take care of our digestive system, let's talk about how we can keep it healthy. Here are some simple but effective ways to take care of your digestive health.
Eat foods rich in fiber, such as fruits, vegetables, and whole grains. Fiber helps digestion and prevents constipation.
Drink plenty of water. It helps break down food and keeps things moving smoothly in your intestines.
Chewing food properly makes digestion easier and prevents stomach discomfort.
Exercise regularly. Physical activity helps food move through your digestive tract and reduce the risk of digestive problems.
Too much processed food, greasy meals, and sugary drinks can upset your stomach and cause problems like acid reflux and bloating.
Your body needs rest to function well, including digestion. Aim for at least 7 to 9 hours of sleep every night.
Feel the urge to go, don't hold it in. Ignoring bathroom breaks can lead to constipation and other digestive issues.
And that's it for today's lesson about digestive system. We hope that you learned something informative and learned something new.
Always remember to take care of your body.
Because a healthy digestive system means a healthier you. Healthier you! Bye! Thanks for watching!